Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. Excuse me. Dr. Darrow, you have a few things you'd like to announce, right?
Of course. Number one, I would love to get some new callers in here. We're going to get to you, Brad, again in a minute to finish up your call. But the phone number to the studio right now, I would love to talk to you, is Dr. Marc Darrow, and we're talking about stem cells and platelet-rich plasma for injections to heal musculoskeletal problems. That's anything from the top of the head to the bottom of the feet, arthritis, shoulder pain, rotator cuff tears, meniscal tears in the knees, you name it. I do the whole body, hips, backs, toes, fingers, wrists. What else did I miss? I don't know. So give me a call right now at 866-870-5752. 866-870-5752. Hope you're not shy. You can pretend you're somebody else. You can talk about your mother or something. And if you want to watch me do videos of these procedures, you can go to www.lastemcells.com, www.lastemcells.com. If you want to call the office now and get more information, you can call 800-300-9300. That's 800-300-9300. We also do something called the vampire facelift. That's something where we inject the same thing that I do, platelets and stem cells. I do it on the musculoskeletal system, but it can also be done on the face to regrow the collagen on the face and make you look beautiful or handsome. Yes, we have as many men as women that do this. Also, this can be used on the top of the head to regenerate hair if your hair is thinning. We can wake up the follicles and thicken up the hair. There's a lot of stuff this regenerative medicine can be used on. Anything else I missed, Nita?
No, I think you covered it. Good job.
Covered it. Yeah, I mean, get a free copy of this book. Call me. Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And Suzanne Summers, the famous actress, wrote the foreword to it. I'm showing a picture right here of her. And she also wrote a book, her recent book, which is called...
A New Way to Age.
That's the one. She has a chapter about Dr. Marc Darrow. Hey, that's me. About the regenerative medicine that I do and how it's worked on her and her family and what the stem cells and platelets are all about. So let's get back to Brad. So Brad, I just want to finish up with you. So you're having, the numbness in the legs. And I want to tell you, I had, when I was a resident at UCLA, we did a rotation at Rancho Los Amigos Hospital down in Downey. And for that entire period, I was limping because of leg pain, okay? And I was freaked out thinking I would have to get a surgery. It was very, very painful. And I was holding on to the walls, limping from patient's room to patient's room. And Brad, guess what happened? My back was injected with regenerative medicine, and guess what? Leg pain went away. I have never had it since. And that's got to be, my goodness, that was probably around 1995, 6, something like that. It's a long time ago. I've never had that sciatica come back. And you have to be careful. It's the razor's edge. If you're having weakness in the leg, you got to do something quick because you don't want to lose that nerve. But if it's just the sensory part of it, then there's often things that can be done. You had one epidural, it worked overnight, and then the goodness of it went away and it didn't work. But you may want to try that again. But I think the best thing is to get someone who does the work I do to examine you and see if that leg numbness stuff is coming from ligaments in your lower back. There are referral patterns. And often if we fix the ligaments in the low back by thickening them up and strengthening up by injecting them with platelets or stem cells, the leg pain can go away. Okay? So a lot on the table for you. And what else? I think that's about it for you. I think we did a good job with you, Brad. God bless you, and thanks for calling in.
Okay, so do you want to talk to Tom?
I would love to. Tom, I'm going to give out the phone number. Then we're going to get to you to call me in the studio. And by the way, thank you, everyone, for calling in. It makes it more fun. Otherwise, I have to torture Nita by telling her bad jokes.
Pure torture.
Yep. So call us right now, 866-870-5752. Give me a call, Dr. Marc Darrow. I'd love to answer your questions about musculoskeletal orthopedic pain and see if we can help you. So, Tom, you're having knee issues. Tell us how long that's been going on.
Can you hear me?
Oh, yeah. We hear you great.
Okay. So I had my left knee completely replaced, and I have to do my right knee. And the surgery on my left knee, to me, it's a success. It feels so much better.
Good.
I have the strength back.
Good.
But what I was wondering was if I could try yours before I do the left one, so I wouldn't have to do the right one, so I wouldn't have to do my right knee.
Well, let me ask you this, because you said it worked great. Why wouldn't you want to do it on the other one?
Because I heard you say it's better not to have surgery if you don't have to.
But you said you had a great result. So I'm being facetious, really, but I do want to hear your answer.
I understand. I'm wondering though, I have no meniscus, no ligament, no tendon. I'm bone to bone, and I have arthritis. The strength in my left knee feels, like I can actually walk and not worry about it.
Sure.
So I'm thinking, well, it worked on the left one. I would rather not do the right one if there was an alternative.
Okay. So are you able to walk around?
Yes.
Okay. You can bend your right knee?
I can bend my right knee further than my left, but as the further I bend it, the more pain I get as I go down.
So your right knee is the one the right one is the one that did not have surgery, and you can bend it more than you can on the knee replaced left knee. Is that correct?
Correct.
Okay.
Correct.
So there's something wrong with that knee replacement that you had. It feels good, but you've lost a little range of motion, right?
Yeah, I'm at 125 degrees on my left knee.
That's not bad. Yeah.
They wanted me at 120. I'm with a therapist who's a friend of mine who owns his own therapy,
Wonderful.
company, and
okay.
And he's worked it. He's worked it really hard, and I've worked hard on my own.
Okay.
It's still not as I can't bend it as far as my right one, but
sure.
As he bends my right one just to compare, then I get the pain in the right one.
Sure. Okay. So just general information. I see a lot of people come in with failed knee surgeries, and definitely a lot with failed knee replacements. Okay?
Right.
And I just had one come in yesterday, as a matter of fact. A woman came in, and she had her, I'm trying to think which one. She had her left knee replaced, and it's her right knee she had replaced, and the side of the knee hurt like the dickens. And she said, "Can you help?" And I said, she said, the joint is making noise, and I can't bend it very far. Can you help that? I said, I can't help that fake joint because that's not biological. That's metal, right? And plastic.
Right.
But her pain was on the lateral or the outside of the knee. And I said, I can help that. I looked with the ultrasound. I saw fluid in there where the lateral ligament was, okay? Lateral collateral ligament. There was fluid in there. I said, I can help that. And she said, but I need help on the whole knee. And I said, I can't help the rest of it. She said, I'm thinking of getting a knee replacement on the other knee, my left knee. And I said, why? This one didn't work for you. You're having pain. She said, well, I don't know what else to do. And that's what the doctors told me I had to do. So I looked at it. I looked with the ultrasound. She had fluid in the left knee. And I said, I think I can help you with this. I don't think you need a surgery at all, let alone a knee replacement. And I haven't examined your knee and I haven't looked with an ultrasound, Tom, but I'm going to bet you anything that you don't need a surgery. And I won't know until I examine it.
Right. I had meniscus surgery years ago on both. But it just, can I, the weakness in my right leg is so the doctor said that my right leg was worse than my left, but I had more pain in my left, so I did the left one first.
Well, that's a good point. Your right one was worse, but you had your left one done because there's more pain in the left one. So worse and better means nothing. Worse and better relates to images. Images are wrong.
Well, yeah, you said, okay.
You can't look at an image to decide if you need surgery or even if you have pain. They don't give those answers. Only the examination does. So, and I'm going to tell you this. I'm going to bet you anything you want. You put up the stakes and I'll hold them in my mouth that you don't have bone on bone in your right knee. It's a statement that's made by surgeons. And I can't say never, I've had a few people over 25 years who have actually had bone on bone joint problems. But everybody's told they do.
Right.
So I wouldn't go quote jump into a surgery. Have somebody like me or me check out your right knee and see what they think. And I'm going to make a bet with you, like I said, anything you want, that you don't have bone on bone and that regenerative medicine using platelets and stem cells might be the answer for you,
When you say platelet, is that when you pull the blood out and spin it?
Yes. It's a very simple procedure. All we do is
spin and and separate the white from the red.
Yes, we take your blood, from your arm. We spin it in a centrifuge. The gravity of the centrifugal force pulls the red cells down to the bottom. The platelets float on top. And we take those out with the plasma. It's called platelet-rich plasma. And then we inject that. And the reason we would never put red cells into your knee, which I've tried before because I experiment on everything, it blows the knee up. You end up with an effusion because red cells are very caustic. They are inflammatory. So we take those out and we just do the platelets. We can also do your bone marrow, which has platelets and stem cells in it. There's a lot of ways to skin the cat.
Okay. My son did that. My son's a baseball player, and he tried that first, and it didn't work. He ended up having to have Tommy John surgery.
Okay.
But I'm willing to try it on my knee.
Okay, now let me just give you my stupid opinion, because I don't tell anybody I'm smart. All I have is a lot of experience, okay? Your son tried it. This is not a kind of procedure you try. It's something you do. And I'm going to bet he didn't need the Tommy John surgery because I treat a lot of people who, quote, need that surgery and never had to get it. But I don't try to do this. I do it until it works.
Okay.
So
all right.
We need,
well,
the reason I'm saying, thank you. The reason I'm saying that is because we're growing tissue. Doing one treatment may not be enough.
Right. All righty. Well, let's give it a shot. I'm going to give you a shot.
All right. That's a good pun because that's what you get is a shot. And the nice news is you don't need anybody to drive you. I've never had an infection. I'm knocking on wood. I do this all day long, every day. We use very sterile techniques. It's what I'm going to call conservative medicine. You walk in, you don't need anybody to drive you. You walk in and you get injections and you walk out and drive yourself home. It's pretty simple.
Okay.
All right, Tom, God bless you. I really appreciate the call.
Thank you, Tom.
Thank you. I am going to make the call right now to your office.
Thank you. That number for other people is 800-300-9300, 800-300-9300. But I want to talk to you right now. Give me a call right now with your musculoskeletal complaints, things that you're thinking about getting surgery for. Please call me first, 866-870-5752. Me and Nita are waiting here for you, 866-870-5752. This is Dr. Marc Darrow. I've been doing regenerative medicine for when 1997, I think I started. I was experimenting on my own body, and I've had great success ever since. And I get about 60 or more new patients a month, believe it or not. And I don't fix everybody. I'm not saying this is the panacea for everything, but most people get better. There's still a lot of failures, like anything in medicine. There's no promises. People come in and they say, can you guarantee me this will work? I go, no way. You're going to actually sign something that says you know there's no guarantee. I would do that no matter what kind of medicine I'm doing. There's no guarantees in medicine. I'm sorry. So you give me a call now. I'm going to mail you out for free. Stem cell and platelet therapy, regenerate, don't operate. It's a big book that I wrote on how to heal the body using regenerative medicine with stem cells and platelets. The foreword is written by the lovely Suzanne Summers, who is a big believer in my work. She wrote a big chapter on me in, what's the name of her new book?
A New Way to Age.
Yes. She's always figuring out new ways to age, because we are aging, but the question is, what's our attitude about it, and what can we do to make ourselves better without surgery and without drugs? That's natural medicine, which is what I like to do. So I think, Nita, it's going to be punishment time.
Okay, but wait, you know what I just realized? If you
Tell me.
started doing this work in 1997, and this is 2022, doesn't that mean you're in your 25th year of doing this work?
Well, why not?
But that's like huge. 25 years is huge. We have to throw you an anniversary party. I think this is a really stellar idea.
But I don't drink and I don't eat sugar, so what am I going to do?
Well, we could get you a sugar-free cake. We could make other drinks for you that are non-alcoholic beverages.
Okay,
You
let's
still
do
eat
it.
food, right?
No, I'm an Aryan.
I see. Did you just make that up?
Yep.
I knew this.
But you know why I have an addiction to cheddar cheese?
Why?
I don't know. I was wondering if you knew.
Well,
But the addiction is only mild.
Yeah, but
'Cause
that's
it's cheddar
okay. So we
cheese.
could give you cheese and crackers that are sugar-free crackers.
But it's only a mild addiction because it's cheddar cheese. You like the sharp cheddar.
No, I don't eat cheese. I'm
All right,
dairy-free.
now I'm going to give a better
Okay,
one here.
okay.
Why shouldn't you write with a broken pencil? Because it's pointless.
That's a good one. That's a good
Okay, one more, and then we're going to do some hard work here.
one. Okay.
Why did the Scarecrow win an award? He was outstanding in his field.
Oh, that's a good one. That's a good one. I think you should give the phone number again, though.
The phone number to the studio is 866-870-5752. Try to stump me. Ask me questions I don't know the answers to. Make
And let's
me
give
learn.
the website, too.
All right, I'll do that. It's www.lastemcells.com. My website has a spot for you to email me on every page, and it's got videos of all the procedures I do, so you can watch me doing this and see if you think it's appropriate. So, Nita, what did the buffalo say when his son left?
His son left?
Yeah. What did the buffalo say when his son left? Bye, son.
Oh, I never would have thought of that.
Come on, Nita. You used to hit these on the head.
I know. I'm thinking about the party. Now I'm obsessed.
You do love parties, don't
I do
you?
love parties.
Well, let me go to a question here, huh?
Okay.
Let's see what I can get here from a question. Where is my questions? I'm lost on my internet here. Here we go. Okay. La 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 la. Oh, I like this one. Terrible triad injuries on both elbows. So typically when we hear about the terrible triad, we're referring to a knee. And it used to happen frequently in football when the players on one team wanted to take out a player on the other team. They would roll on the outside of the knee. They roll their body, throw their body at it, and create O'Donoghue's terrible triad. They would rip the medial collateral ligament, the meniscus, and the ACL all at one time. That player was probably out of business for either forever or for a long time after that. I think it's illegal to do that now. But this one is about the elbow. And the terrible triad injury of the elbow is typically a traumatic injury pattern of the elbow, which has elbow dislocation, the radial head neck fracture, and the coronoid fracture. Those are all parts of the elbow. So that's a pretty bad injury. And let's see what the person says. Hi, Mark. That's me. Love what you do. Really cool to see someone helping so many people and loving what they do. I do love what I do. It's so much fun. Listen, I got into a major car accident where I had 2 terrible triad injuries in both elbows, and the surgeries went south. I have a 30-degree loss of extension in both elbows. I was just wondering if stem cell therapy can help me regain motion. I wake up with pain every day, and I'm only 25 years old. Would love to hear your thoughts and get some insight on your professional opinion. Thanks in advance. Well, I'm not going to say the person's name, but thank you so much. It's a great question. The answer I don't have until I examine you and look with the ultrasound and see what's going on with your shoulder. With your elbows. I have had a lot of people with terrible elbow injuries with lack of range of motion. I've been able to help. We put cells of regenerative medicine platelets and or stem cells into the joint, if that's what the issue is. And a lot of times, the inflammation that creates is very cool because it brings white blood cells to the area that can often chew up the scar tissue and get rid of it. So I'm not promising anything. I have to see this gentleman first and see if he wants to go with this and see if we can help him. I don't know the answer, but there is good hope. Here's another cool one.
Okay, wait. We have calls.
Making my job easy. I love talking to people. So let's see. Let's go to John. He's got back pain. We've got Chris with neck pain. Let's take Chris first with the neck pain, if you don't mind, John, because we already talked about backs a little bit, but we'll get to you. So, Chris, how long has your neck been bothering you?
About 9 years.
Whoa. And what did the doctors tell you is wrong?
Well, I work in the aircraft industry, and it's doing the bottom of the wing. My neck's bent to the side.
Yep.
So I have a collapsed cervical 6-7 or something like that.
Sure.
Where it's blown out on the side.
Yep.
I can send you the MRI and the CAT scan.
Okay. Do you have pain down your arms or just in your neck?
No, the arm is growing number and number day by day. I'm only concerned with it within the last 6 months that I noticed it's really getting numb. My fingertips are getting numb.
Okay. And do you have neck pain?
Yeah, I have.
Okay.
The neck pain is not as bad as now the arm.
Okay. So you have most likely what we call a radiculopathy, and we had Brad talk about the same thing with his low back, a caller before you. And it's something I may be able to help, may not be able to help. I may be able to help the neck, but you're saying that's not as bad as the arm. So I'd have to examine you and see what the story is, okay?
Yeah. Well, my doctor said that the nerve between 6 and 7
Yep.
is pinched or smashed.
Yep,
So he took
I hear
the
you.
MRI and the CAT scan,
Okay.
and you can see, obviously, it's being smashed pretty bad.
Okay. Well,
That's
you may
why my
need a surgery for that. Before you did that, you may want to try an epidural. You definitely want to get an EMG and nerve conduction study to see what's going on. And John, I'm sorry. Go to the website and you can email me from there, and we'll pick up with you. That's www.lastemcells.com. If anybody wants to call the office, it's 800-300-9300. God bless you all. Thank you, Nita, Alex, Suzette, and it was a great show. Appreciate
and
it.
remember to listen to our pal Warren Eckstein on The Pet Show every Saturday from 11 to 1. I'm Nita Valens, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.